If you've been extra thirsty lately, waking up to use the bathroom more often, or feeling tired even after a normal day, your blood sugar may be sending signals. A lot of people brush these off as just getting older or stress, but these can be early warning signs of type 2 diabetes. In this video, you'll learn the most common signs people miss, plus the daily habits that can help protect your blood sugar before small symptoms turn into bigger problems. Type 2 diabetes often develops gradually, which is exactly why it's so easy to miss. Some people have symptoms that come and go. Others don't notice anything until routine lab work, or until complications start showing up. Over the next few minutes, this video will walk you through the warning signs to watch for, what they mean inside the body, and a step-by-step daily routine that supports steadier blood sugar, using simple actions that fit real life. Let's start with the signs that are common and commonly ignored. First, increased thirst and urination. People often notice they're refilling water more or waking up at night to use the bathroom. Second, fatigue that doesn't match your day. You sleep, you rest, but you still feel drained. Third, blurry vision. Sometimes it's subtle, like you're squinting at your phone or TV more than usual. And there are other clues too: numbness or tingling in your hands or feet, sores that heal slowly, and frequent infections. None of these automatically mean diabetes, but together, they're a reason to pay attention and get checked. Here's what's going on physiologically. When blood glucose stays elevated, the kidneys work harder to remove excess sugar, which pulls water with it, so you urinate more and feel thirstier. Over time, higher glucose levels can interfere with normal nerve function, affect how the eyes focus, and slow the body's repair process. That's why symptoms like tingling, vision changes, and slow healing can show up. Here's the key: symptoms are not a diagnosis, but they are useful signals, especially if you also have risk factors like insulin resistance or a history of higher blood sugar. The smart next step is testing. One common test you'll hear about is the A1C. Instead of showing a single moment in time, A1C reflects your average blood sugar pattern over the last couple of months, so it's a powerful, big-picture marker. A1C is widely used to help diagnose diabetes and prediabetes, and it gives clinicians a longer-range view than a single fingerstick reading. The important part is not just the number, but what that number suggests about your overall glucose exposure over time. Coming up next, the blood sugar spike cycle, the daily pattern that quietly pushes glucose higher, even in people who think they eat pretty well. And you'll learn the easiest interrupt that can start helping the very first day. Here's a truth that surprises people. Blood sugar problems usually aren't caused by one meal. They're built by repeated patterns: how you eat, how long you sit, how you sleep, and how your body handles stress. The good news is that if patterns create the problem, patterns can also help reverse the trend. To understand type 2 diabetes, you need one simple concept: insulin resistance. Insulin is a hormone that helps move glucose from your blood into your cells, where it can be used for energy. With insulin resistance, that process becomes less effective, so glucose stays in the bloodstream longer. Over time, the body may try to compensate by producing more insulin, but the system can start to struggle. Insulin resistance is strongly associated with factors like overweight/obesity, physical inactivity, and genetics, and risk rises with age. This is why early lifestyle changes, before glucose stays high for years, can be so impactful. Now for a practical tool: movement after meals. You don't need a hardcore workout. Even a short walk after eating can help your muscles use glucose more effectively, so the after-meal rise isn't as sharp or as long. If there's one place to start after dinner, because that's often the meal followed by the most sitting. Evidence shows that breaking up sedentary time and adding light activity can improve glycemic control in adults with type 2 diabetes. The mechanism is straightforward. Active muscles use glucose and become more insulin sensitive, which supports steadier post-meal numbers. Here's the trap: even if you exercise, long uninterrupted sitting can still work against your blood sugar. Think of sitting as turning down muscle activity for hours. The fix is simple: stand up and move briefly, often. Studies show that interrupting prolonged sitting with light activity improves glucose control markers, especially when done consistently throughout the day. Sleep is the most underrated blood sugar habit. When sleep is short or disrupted, the body can become more insulin resistant, so the same breakfast can lead to a bigger spike the next day. This is why doing everything right with food can feel harder when sleep is off. Research links insufficient sleep with reduced insulin sensitivity and impaired glucose tolerance. That doesn't mean one bad night causes diabetes, but chronic poor sleep can push the body in the wrong direction. Next, how to build meals that keep glucose steadier, without extreme rules and without needing to count every bite. No perfect foods, no magic supplements, just smarter combinations that make blood sugar easier to manage. One of the simplest strategies is this: don't let carbs hit alone. When you pair carbohydrates with protein and fiber, digestion slows down and the glucose rise tends to be more gradual. That doesn't mean carbs are bad. It means the context of the meal matters. A bowl of sugary cereal by itself is different from a balanced plate that includes protein and fiber-rich foods. When glucose rises quickly and often, the body is forced to repeatedly manage larger surges. Over time, frequent high glucose exposure contributes to metabolic strain and can worsen insulin resistance. A balanced plate reduces how hard the system has to work after each meal. Next, what you drink. Sweet drinks are one of the fastest ways to push glucose up because they're absorbed quickly and don't come with fiber. And here's the frustrating part. If you're already thirsty, it's easy to reach for something sweet, then feel even thirstier later. Higher blood glucose can increase urination and dehydration sensations. Replacing sugary drinks with water or unsweetened options can remove a major hidden source of glucose load. Another habit that helps many people: consistency. When meals are unpredictable, it's easier to oversnack, eat very late, or graze all evening, especially after a stressful day. A simple routine isn't about perfection, it's about reducing surprise spikes. Because insulin resistance is closely tied to weight and activity patterns, daily structure that supports healthier choices can indirectly improve blood sugar control over time. Now let's talk movement. What to do if you're busy, out of shape, or dealing with knee and back pain, but still want results. The best exercise for blood sugar is the one you can repeat, not the one you do once and quit. A practical benchmark many organizations use is aiming toward about 150 minutes per week of moderate intensity activity, often something as simple as brisk walking. You can split that into small pieces, 10 minutes here, 15 minutes there, and it adds up. What matters most is consistency across weeks, not one perfect workout. Regular physical activity supports better glucose control and overall cardiovascular health. Starting small is completely valid, especially if you've been sedentary, because the body adapts step by step. Weekly calendar. 30 minutes by 5 days equals 150 minutes. Strength training helps because muscle tissue is a major place where glucose can be used. You don't need a gym. You can use resistance bands, light weights, or even chair-based movements. The goal is to build a body that handles carbohydrates better. Scientific statements on exercise and diabetes note that aerobic exercise improves glycemic control, and resistance training can also improve A1C in adults with type 2 diabetes. A combination tends to work well for many people. Here's your simple rule: don't be still for too long. Set a reminder, stand up, move for a couple minutes, then get back to your day. This is especially important after meals and during long TV or computer sessions. Interrupting sedentary time with light activity improves glucose regulation, and it's one of the most realistic strategies for people who can't commit to long workouts yet. Last part: stress, sleep, and the exact checklist to follow tomorrow. Plus, when it's time to talk with your clinician about testing. If your blood sugar feels unpredictable, it might not be only food. Stress and sleep can change how your body responds, so the same meal can hit differently depending on what your nervous system is dealing with. Stress isn't just in your head. When stress stays high, your body releases hormones that prepare you for action. That can push glucose higher because the body thinks you might need quick energy. In modern life, the stress is constant, but the sprint never happens, so glucose and hormones can stay elevated more often. During stress, counter-regulatory hormones can raise glucose production and increase insulin resistance. That's why stress management can be a real part of metabolic health, not a nice extra. Sleep is where your body recalibrates. When sleep is consistently short or poor, insulin sensitivity can drop, hunger cues can change, and willpower gets harder. So instead of trying to be perfect with food, protect sleep like it's part of the treatment plan for your future self. Research connects insufficient sleep with impaired glucose tolerance and reduced insulin sensitivity. Improving sleep won't replace medical care when it's needed, but it can remove a major barrier to better glucose control. If you're noticing frequent thirst, frequent urination, fatigue, blurry vision, tingling in hands or feet, or slow healing, don't just wait it out. Make a plan to get checked. Testing turns worry into clarity, so you can take the right next step. A 1C is a standard test used to help diagnose diabetes and prediabetes, and it reflects average blood sugar over about 2 to 3 months. Clinicians use results along with your history and other tests to guide next steps. Here's your simple tomorrow checklist. Don't try to do all of it perfectly. Just start. 1. Take a short walk after at least one meal. Dinner is a great first choice. 2. Aim toward a weekly movement routine. Small blocks count, consistency wins. 3. Add a couple short strength sessions each week using bands, light weights, or chair moves. 4. Break up sitting time. Stand up and move briefly, repeatedly. 5. Choose a calmer evening routine and protect your sleep, because sleep changes how your body handles glucose. If this video helped you understand the warning signs and what to do next, subscribe to Wise Nourish for practical, science-backed health habits. Comment the word checklist and tell us which one you're starting first: post-meal walking, better sleep, or breaking up sitting. And if you want, share this with someone who keeps saying, "I'm just tired lately," because sometimes tired is a signal, not a personality trait.